Welcome. Thanks for clicking it. Upper respiratory infections are common problems that affect millions of people worldwide. This lecture aims to provide a factual and logical understanding of upper respiratory infections, exploring their causes, symptoms, and available treatment options. Now let's talk about causes. Upper respiratory infections are caused by various infectious agents, including viruses, bacteria, and sometimes fungi. These infections primarily affect the nose, throat, and the upper part of respiratory system. Here are some common causes of URIs and the reasons they occur. Number 1, viruses. Viral infections are the most common cause of URIs, with the rhinovirus being the most frequent culprit. Other viruses that can cause URIs include influenza viruses, respiratory syncytial virus, coronavirus, adenovirus, and parainfluenza virus. Viral URIs are highly contagious and easily spread through respiratory droplets when an infected person coughs or sneezes. These infections are more prevalent during the colder months when people spend more time indoors in close proximity to each other. Number 2, bacteria. Less common than viral infections. Certain bacteria can also cause URIs. Streptococcus pneumoniae and Haemophilus influenzae are the most common bacterial pathogens associated with URIs. Bacterial URIs often occur as secondary infections following a viral infection when the respiratory tract is already weakened, making it easier for bacteria to invade. Allergies. Allergic reactions such as hay fever or allergic rhinitis can cause inflammation and irritation in the upper tract. When an allergen such as pollen or pet dander is inhaled, the immune system reacts by releasing histamines and other chemicals, leading to symptoms like nasal congestion, sneezing, and runny nose. Although allergies themselves are not infections, but the symptoms can mimic those of a URI. Environmental factors. Certain environmental conditions can contribute to the development of upper respiratory infections. Cold weather can dry out the nasal passages, making them more susceptible to viral and bacterial infections. Low humidity levels in heated indoor environments can also cause drying of the respiratory mucosa, impairing the body's defense mechanisms against pathogens. Weakened immune system. Individuals with a weakened immune system, such as those with HIV/AIDS, undergoing chemotherapy or taking immunosuppressive medications, are more susceptible to upper respiratory infections. A compromised immune system reduces the body's ability to fight off pathogens effectively, increasing the risk of infection and prolonging the recovery time. Close contact and crowded environments. URIs are highly contagious and can spread easily in crowded places like schools, offices, and public transportation. Close contact with an infected person, such as sharing utensils, touching contaminated surfaces, or being in close proximity when they cough or sneeze, increases the risk of transmission. Smoking. Cigarette smoke irritates the respiratory tract and weakens the body's natural defense mechanism, making smokers more susceptible to upper respiratory infection. Smoking damages the cilia, which are hair-like structures in the airways that help sweep away mucus and trapped pathogens, allowing infections to take hold more easily. Poor hygiene practices. Inadequate hand washing, particularly after coughing, sneezing, or using the bathroom, can contribute to the spread of upper respiratory infections. Touching contaminated surfaces and then touching the face can introduce pathogens into the respiratory system. Here are some common symptoms and signs of upper respiratory infections and how they occur. Sneezing. Sneezing is a reflex action that occurs when the nasal passages are irritated. It helps to expel irritants and infectious particles from the nose and throat. Runny or stuffy nose. The viral infection causes inflammation of the nasal passages, leading to increased mucus production. This can result in a runny or congested nose. Nasal congestion. Swelling and inflammation of the blood vessels in the nasal passages can cause blockage and congestion, making it difficult to breathe through the nose. Sore throat. The viral infection can cause irritation and inflammation of the throat, resulting in a sore or scratchy feeling. It may be accompanied by pain or discomfort while swallowing. Cough. Upper respiratory infection often cause a dry or productive cough. The cough is the body's attempt to clear the airways of mucus or irritants. Mild headache. Headaches can occur as a result of sinus congestion and inflammation. The increased pressure in the sinuses can lead to discomfort or mild headaches. Fatigue. The immune system response to the viral infection can lead to fatigue and a general feeling of tiredness. The body diverts energy to fight off the infection, which can leave you feeling drained. Mild fever. A low-grade fever is a common symptom of upper respiratory infection. It is the body's natural response to fight off the infection. Watery eyes. Inflammation of the nasal passages and sinuses can cause excessive tear production, leading to watery eyes. Body aches. Some individuals may experience muscle aches or body pain during an upper respiratory infection. This can be due to immune response and the release of chemicals that cause inflammation. Now, it's important to note that the symptoms and severity of upper respiratory infection can vary from person to person. Most cases resolve on their own within a week to 10 days with rest, hydration, and supportive care. However, if symptoms worsen or persist, it is advisable to seek medical attention. Now, let's talk about some treatment options for upper respiratory infection. Number 1, symptomatic relief. Most upper respiratory infections resolve on their own within a week or two. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help alleviate discomfort associated with sore throat, headache, and fever. Nasal saline sprays or rinses can provide relief from nasal congestion. Number 2, rest and hydration. Getting plenty of rest and staying hydrated is crucial for a quick recovery. Adequate fluid intake helps thin mucus secretions and prevents dehydration. Number 3, nasal decongestants. Short-term use of nasal decongestant sprays or drops can provide temporary relief from nasal congestion. However, prolonged use can lead to rebound congestion and should be avoided. Antiviral medication. Antiviral drugs may be prescribed in specific cases such as influenza infections. These medications can help reduce the severity and duration of symptoms if taken early in the course of the illness. Antibiotics. Antibiotics are not effective against viral infections and should not be prescribed unless a bacterial infection is present, such as in the case of a secondary bacterial sinusitis. Prevention strategies. Practicing good hand hygiene, covering the mouth and nose when coughing or sneezing, and avoiding close contact with infected individuals are crucial in preventing the spread of URIs. Additionally, annual influenza vaccination can help protect against influenza-related URIs. Take-home message. It's important to note that each individual's susceptibility to URIs can vary based on their overall health, immune system function, and exposure to risk factors. Practicing good hygiene, avoiding close contact with infected individuals, and maintaining a healthy lifestyle can help reduce the risk of upper respiratory infections.